All right. Hey, welcome everybody to the new Gloria Bailey Ray show. I'm so excited that you guys are here, and it's such a pleasure to see each and every one of you. Happy 2023 to all of you that are tuned in. And I want to thank you guys all for joining me today. And I hope that 2023 will bring lots of changes in a positive way for each and every one of you. Formerly called the You Didn't Get the Memo Show, this is one change. Now going forward, it will be called the Gloria Bailey Ray Show. Now, listen, I'm still going to bring you great guests. I'm still going to bring you great content that is informational, it's educational, at times it's inspirational and motivational. So I ask for your continued support as we continue to ramp up and rebrand. Again, I want to thank you guys so much for being here and tuning into the show. For those of you who are watching the show, and if it's your first time, but also for those of you, if you recall, who have been what I call my lifers, you've been with me since the beginning of this, I want to just to remind you that the show is interactive and it's about providing you, the viewer, with relevant, fact based, mainstream information to help you be informed and to make informed decisions. Now, you guys probably see with I don't know where some of you are at, but we're here in Northern California and we have been rained on, and we're hoping to be able to get through this particular show. But just remember, you got questions for my guests. Feel free to put them in the comment section. We'll do our very best to respond and to get answers to you or just respond back to you. All right. And so I want to also remind all of you to follow me on all my social media platforms, which is, of course, YouTube, Facebook, LinkedIn, Instagram. And if you missed the show or you missed a portion of the show, be sure and go back, check it out on YouTube under Gloria Bailey Ray, but be sure and click the live button. Gloria Bailey Ray. All right. So let's get started without further ado. I'm excited to introduce my guest today, Dr. Alicia Rozario. And we're going to be talking about getting serious about foot care. So, Dr. Rosario, welcome to the show today. It's so great to see you, and thank you for making the effort in the storm and all the things that are going on.
Well, thank you for having me. Yes, it's been wild. Every day it's like rain, winds. I'm like, is this Armageddon? Is this biblical times? I'm like, no, it's all
Right.
right. God is on my side. It's all good. But
Come on now, come on. Come on. Absolutely. And it has been, but you said the word God is in control. So you
mhm.
know that. And my thing is, we can't do anything without God. So let's keep it real, okay?
That's right. There you
Yeah.
go.
So I'm so excited that you are here with me. And like I said, we want to talk about something that's near and dear to me and to all of you. Thank you guys so much for being here. And I'm just so very, 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 very happy to have you. So let's just jump in and let me just give a shout out. I see all of you. So good evening to all of you for being here. Delane, Maisha, San Antonio in the house, Arkansas in the house. Thank you guys. All right. I know, Emmanuel, we got Africa in the house. So it's so good to see you guys. But let's start and let's get some information and find out about Dr. Rozario. So, Dr. Rozario, why don't you start with telling us a little bit about your backstory?
Absolutely. So I was born in Oakland, but I grew up in the Central Valley. As soon as I got a chance, I got out of that hick town of mine and went to college in the opposite end of the country, as far away as I could in the continental United States, which was upstate New York. Went to Cornell University. It was an amazing experience. After that, I served in the military. I am a Navy veteran. I was stationed in Virginia and was on the aircraft carrier. I was deployed twice. After that, I went into podiatry school. And since then, just been on a journey in terms of my training and lived in different parts of the country from Seattle, which is where I did my residency. I actually went to podiatry school in Oakland and did some advanced training work in New York and decided to relocate in 2020. And this is where I am and plan to stay. So it's been an amazing journey.
Awesome. And I think that it's always good to give the backstory, right? Because a lot of times people are like, well, where do you guys know I bring it to you live, and it's always about us being authentic. So you can see that Dr. Rosario, um, her experience and her knowledge, it just speaks for itself. So let me just ask you this, Dr. Rosario, what was it that made you become interested in medicine? And then the other piece of that is to talk about, those initials DPM, and let's differentiate the difference between an MD and a DPM. But let's start with what got you interested in medicine.
Yes, absolutely. Ever since I was young, I knew that I wanted to help people. So I was heavy into community service. I would even receive awards and so forth when I was young. And I do have quite a number of family members who are in the healthcare field. So that also planted a seed. So early on, I was just drawn to the field of medicine. In terms of my podiatry uh, choosing podiatry, I should say, there is definitely a difference between the MD and DPM route. For me, I was pre med in college. After that, I served in the military. At that time, I noticed that feet were important. People were going down. So I actually used to shadow and job shadow in the clinical ward on the ship when I was deployed. Quite a number of sailors came in with foot problems. I was like, there's something there. And then I thought about when I used to just stand watch, meaning that you're on duty for several hours at a time, and people would complain about their feet. I did too, actually, and people marching and coming in for so many different foot issues. So that was one thing where I was like, maybe there's something to this. After serving in the military, I actually went back and communicated with my old pre med advisor, and she told me about, yes, that there's the traditional MD route, but then there's also non-traditional paths. And she did mention podiatry to me. So I did a little digging, and funny enough, I had a family friend who practiced in Fresno. So job shadowed him, and he had quite a number of people who, yes, came in with the basic foot problems, but then also had diabetics, and him treating people with diabetics, having ulcers or like open sores, and which would lead to amputations and so forth. And that really struck a chord with me because I have people in my family that have diabetes and who have actually succumbed to diabetes. So that also was led me to think, there's something to this. And I also like the fact that it was a non-traditional path, and that when you went to podiatry school, which is different from an allopathic or osteopathic program, you know what you are right away. So I knew I was going to podiatry school to become a podiatrist. So that appealed to me. And what was the cherry on top was that there was a podiatry school in Oakland. And I did want to come back to California and specifically be in the Bay Area near family and friends. So it just made sense for me. And since then, that has been my focus in terms of podiatry, dealing with people with all sorts of foot ailments, but also with diabetics, which I'm most happy about. Again, in terms of the MD route, that is completely different, and that you go to a medical school for your program. During that time, you kind of are able to get a sense in the latter years in terms of what type of specialty you want to enter. And at that point, you would enter a residency in that specific program. And from there, you would practice. In podiatry, you went to podiatry school, and then you go to a standard podiatric residency program, although there are some special subspecialties within that. And then you practice podiatry. I did my residency in at a VA hospital in Seattle, which was I was super excited about. I was a veteran. I wanted to work with vets, and that's where I worked primarily with veterans, most elderly, and quite a few with diabetes.
Yeah. I'm glad that you broke that down because you are so absolutely correct. When people decide that they want to become a physician, a medical doctor, MD, the path isn't clear. It just seems to be, usually, I think a lot of them probably don't even figure out what they want to be, especially after their internship when they go into a residency, trying to figure it out. But I love the way you said, you know what? I knew exactly what I was going to be and what I was going to do. And for those who are out there tuned in and you're wondering, what a great feel. Because as you're talking, one of the things that I think about, Dr. Rosario, is the fact that when your feet hurt, everything hurts.
Okay.
Not working, that's a whole nother realm, and I love that. So let's transition and talk about, do you specialize? Do you have a specialty as it relates to podiatry and what you're doing?
Yes, thank you for asking. I actually do. As I mentioned earlier, I did participate in a fellowship training program. So for 1 year, I was a part of a wound care fellowship training program in New York City. And that's where I did an intensive program working not just with diabetics, actually, but all sorts of persons with wound issues, from people, for example, with sickle cell to, yes, diabetics. And with that, I also learned about limb salvage, where you could do things to prevent ulcerations. Like, for example, if you have uh, hammer toes, actually, in doing surgery or doing some type of conservative work, you can then prevent ulcerations, which would then prevent amputations. So, actually, wound care is one of my specialties. Also, orthotics. So in terms of orthotics, I do 3D imaging, and I'm also in a training program right now to develop custom orthotics. And I find that that's important too, because with feet, shoes are important, good shoes are important, and also what are in those shoes. Not everybody has strong feet, if you will, so they need a little help. So that would involve inserts, and that could be over the counter inserts, but most people actually need custom inserts by the time they see me. So that's something else too that I specialize in. And last but not least, and which is very common, is nail care, and specifically ingrown toenails. So, and I think we're going to talk about this a little later, but people with ingrown toenails, it's really best to see a professional.
And look, I'm sitting here and I'm thinking, okay, this is not the do it yourself, right? Because what happens, and I just think about having sold products in the wound care arena, Regranix gel was one of those products. And the thing was, you see people who maybe was borderline diabetic or didn't know that they were diabetic, and they decide they're going to cut their ingrown,
Mm-hmm.
and the toenail gets, of course, infected.
Absolutely.
They keep trying to do the home remedies. And what happens? So, whoever I'm speaking to out there, y'all, hear me. Dr. Rosario has a practice, she's available, but do not try to trim your toenails yourself. Look, did I encapsulate that correctly? Is that
You
there?
got it down, Miss Gloria. That's Heed her warning, people. Heed her warning.
Absolutely. And so, when we talk about feet, and I'm going to ask you this question, and we're going to take a quick break. And when we come back, allow you to expound on it. But something for you to think about is, what are the two most common causes of foot problems? And you kind of led into it by talking about not having strong feet. But let's go a little bit deeper with that. And I'm going to say to all of you, I love your comments. Thank you so much. I will share them with Dr. Rozario, but don't go anywhere, you guys, and call up some folks and have them join in as well. But we're going to take a quick break, right? And we'll be right back. Don't go anywhere, you guys.
Life doesn't always give you time to change the outcome. Prediabetes does. With early diagnosis, prediabetes can be reversed. Take the 1-minute prediabetes risk test today. Go to doihaveprediabetes.org.
My Shiro doesn't always wear a cape, but she always has time for a hug, a smile, for going the extra mile. My Shiro stretches every dollar, puts in long hours, puts others first. But now it's your time, Mom. When you're ready to retire, we want you to be able to enjoy it. It's time to start saving now. A free 3-minute online chat can give you the personalized tips you need to start boosting your retirement savings today. Visit aceyourretirement.org/Shiro.
All right. I want to thank you guys so much for tuning in. We are talking and having just an in-depth discussion with Dr. Alicia Rozario, who is a podiatrist, and we're talking about your feet. And so, kicking off 2023, all I could think of was James Brown was talking about get on the good foot. Well, we need to get on the good foot when it comes to taking care of our feet. So before we went to break, Dr. Rosario, I asked you the question of, what, in your opinion, are the two most common causes of foot problems?
Absolutely. So thinking about that question, I would just say the top two would have to be wearing ill-fitting shoes, and honestly, and this is a tough subject to mention, but your weight. So in terms of ill-fitting shoes, you see that in from women wearing high heel shoes and trying to look cute, or even if you're just wearing regular shoes, you're like, hey, I went over and I got some Skechers and my feet are still hurting. Well, that too, if it's just not giving you the proper support you need. And especially you think about it, if you have flat feet, it's not doing you any good. It's just making things worse. It's exacerbating the situation. And in terms of weight, again, that's a sensitive topic. There are actually some more common foot problems, but I just have to state this, especially too, because I believe the majority of viewership are persons of color. So in the African American community, weight is a serious matter. So when you look at the statistics and so forth, it shows that even just 1 pound over your ideal weight can cause up to 8 extra pounds on your feet. In terms of, they even say something about, if you lose just 5 pounds, that can be a release of up to 30 pounds of pressure off of your feet. So people will come into my office, they'll be like, I don't understand, my feet hurt, like in the balls of my feet, or my heels, or my inner ankles. And I go through the I'll go through the potential causes. I'm like, okay, they didn't have an injury. They haven't had a change in their activities. And one of the one of the things which really pops out is their weight. So in terms of that, just over time as you age and so forth, your body is already going through a wear and tear process already, like degeneration. And so with that, if you're adding this in terms of weight, that can just make things worse. Okay. So people that have issues in their joints, people that have issues in terms of the muscles and so forth. When you have the extra weight, that could just make things a whole lot worse.
Oh, wow. Yeah, that just hearing that, I'm like, okay, Dr. Rosario. So I'm going to have to get on the good foot and do some other things. But I noticed that there are some comments about plantar fasciitis. So, can you speak to that? And I know, a family member that is dealing with it, and it is just so painful in trying to walk. And I mean, would love to hear your take on that, on treating it and what they can actually do.
Oh, yes, absolutely. So we just talked about causes of foot problems, but as far as common foot problems, that's one of the top is heel pain or plantar fasciitis, which is the inflammatory condition. So most people with plantar fasciitis, one of the telltale signs that they get pain with first steps in the morning, and that it just seems like no matter what they do, especially if they're on their feet all day, it gets worse and worse. So one thing that people can do to help themselves, believe it or not, is a good old fashioned stretch of your feet, like doing a runner stretch. Or if you get a towel and you put it on the bottom of those balls of your feet and pull, that can actually help because it's all connected. Another thing too, with in terms of heel pain, if you wear those good arch supports, really strong arch supports, that can help. But yes, it is a very common situation, which there are different types of alleviating treatments, whether it's again stretching, which you can do immediately for yourself. Some people, if they're like, look, I just don't have the time, I can't reach my feet, it's hard for me to keep up with the stretching, you could get what's called a night splint. You can look it up on Amazon and so forth. It pretty much does the work for you. And there are things that you can do um, as far as making things better. But hey, if you come on down to my office or really any kind of provider, we can also provide you other solutions, which may even be as simple as some steroid injections because it is an inflammatory process. So to keep everything calmed down.
Oh, okay. Awesome. We have another question from the viewer. They wanted to know, um, can you touch on arthritis in your feet and how to relieve pain?
Yes.
That's,
So
yeah.
yes. So one thing is with arthritis, you definitely see that in certain parts of your joints because when you think arthritis, it's really where there's pain in the joints. And again, when that cartilage is starting to break down and where those bones are starting to rub together. So you'll see then people with bunions and even their that area where their big toe is may even start moving in a certain kind of direction that you may not want it to go or getting even larger and larger. Um, so, in terms of arthritis in their feet, there are things that you can do. One, to help it, again, going back to the basics, the fundamentals, good shoes, good shoes. And then also those arch supports. Those things, those are the most basic things that you could do. Uh, Also, too, because you do see arthritis, it is an inflammatory condition. You can take certain kind of medications, such as ibuprofen, naproxen. Those also can alleviate your symptoms. But in terms of that, you make sure you check your own medical state to see if you're in a position to do that. So with that, you may even want to consider consulting your doctor, your primary care provider.
Yeah. Okay. So you bring up a couple of things. So let's go back to you were saying in terms of the type of inserts. You can go and find, I mean, Dr. Scholl's, they're everywhere. What's been advertised a lot lately on on television is the Good Foot store, the Good Feet store,
Mhm.
and so, for me, I'm thinking one of the things having arch support. So this is why I think going to see a podiatrist. I'm talking about somebody who's really going to talk to you about your feet, not just kind of want to debride and send you on your way, especially if it's a condition that keeps coming back. But how does one determine what would be the best inserts for them? How do they do that? Do they just go and pick out something, or is it something that you would prescribe for them and help them to make that decision?
Yes, that's an excellent question. So there are different types. There are plenty of over-the-counter inserts that are on the market, some of which are podiatry approved, like our seal of approval. In terms of good over-the-counter inserts, if you're going to do it, get them on your own. Don't go for the soft, flippy, floppy kind. That's not going to do anything for you. People say, "Oh, I like because it feels soft." It's like, okay, great, but it's still not giving you what you need. And what you need is for your foot to be propped up in terms of the proper arch. And depending on where your joint pain is, say it's in your bunion, you also want that relief from off of that joint. So you may need to get some type of inserts where your big toe is what's called offloaded, which means all that pressure isn't going to be on your big toe when you're walking. So a good rule of thumb, if you're going to get over the counter inserts, in terms of the stages in which you may need to get certain type of inserts, is to get inserts that are on the harder side. Okay. So, and think back to what we talked about earlier, weight. Your whole body weight is on your feet. Okay. So you want to have the enough support to where it's going to be able to support it, like the insert is going to be able to support your weight. Okay. So I would advise, if you're going to do over the counter insert, get get them that are more on the harder side. In terms of if you may need custom inserts, with that, it really depends on your foot type. Say people, hey, I've been trying all these different kind of inserts, they're not helping. Well, in that case, you may need to see a podiatrist. And in that case, we would do an analysis of your feet and see what kind of insert would make sense in terms of a custom insert. And in that case, that's where we make different type of manipulations to the insert itself to accommodate your specific foot condition.
Okay. Oh, wow. We've got tons of questions. So let me see. Let's get to a question here. Should a diabetic patient go to a regular nail salon for foot care? That's a question one of the viewers is asking.
So I so to answer your question, simply no. So diabetics, they're at their most vulnerable in general. They tend to be compromised. It doesn't matter if they say, "Oh, my sugar's controlled." Once you're a diabetic, you're compromised, and your feet is the most vulnerable aspect. Again, we kind of mentioned earlier, people with diabetes are at greater risk of having skin breakdown in their feet, okay, which leads to ulcerations and possibly amputations and loss of life. So, in terms of your feet, whether you have corns, calluses, thick nails, you need to go to a professional, be it seeing a podiatrist where they would do that exam. And also, too, there are certain places where there are medical spas. For example, I work in tandem with a medical spa called Delaine's Natural Nail Care, where my office is actually in the Medi Spa, and they do specialized pedicures where they work with diabetic patients. And the whole thing with people with diabetes, for example, is that again they're because of diabetes, they're just everything is kind of different, even to like their joints. and how they walk and so forth, they're more susceptible to even getting corns and calluses and so forth. And so seeing a podiatrist, seeing a uh, people who specialize specifically um, with in terms of treating people with diabetics, as far as people that are specially trained, medically trained nail technicians, those people can prevent uh, these later outcomes. And as simple too, not even with diabetics, but people who just have issues with their feet and they're not able to get down and take care of their feet. All of this has to do with even just fall prevention. Because if you're not able to walk properly because you have these thick toenails, you can't get your shoe on right, or you have these corns and calluses, your feet just hurt. You're going to start changing what's called your gait, walking funny. Okay. And especially if you're overweight or if you're older, your the way you walk is already compromised, and with those other things going on, you're more susceptible to being a fall risk. And from that, all sorts of things can happen. So as far as consequences.
Yeah. Okay. Awesome. Well, keep the questions coming, you guys. But since we're talking about feet, how often should people inspect their feet? And I ask this question because I actually watched a TV show with someone who has a huge show. And she actually said, "Oh, I don't wash my feet. I don't even wash between my toes." And I'm thinking, did she really say that on national TV? But yes, she did. And so the question on the table is, how often should people inspect their feet? And as much as it seems like it's obvious, but coming from a professional, you know, what say you?
Yes, I will say for diabetics, daily. It's not even a question. For diabetics, don't even compromise yourself. Check your feet daily. Again, what I mentioned earlier, you're more vulnerable. You're more vulnerable. So with that, if you're able to, check the bottoms of your feet every day, check between your toes. If you can't reach your feet to bend your leg over and look, get one of those long armed mirrors, and you could look and see for yourself. One other thing too with diabetics, not only check your feet daily, but put your hand in your shoes. Okay, look in your shoes. Okay, make sure there's nothing in there. Okay, that's really important. I've had patients come in, diabetic patients, and they'll have all sorts of stuff in there, like thumbtacks, pieces of whatever. And I'm telling them how much that was a risk, and that all sorts of things can happen. So for diabetics, check your feet daily. In terms of the everyday person, I would actually look at your feet after you shower. So while you're getting changed and so forth. So I mean, as often as you shower, whether it's daily, whether it's every other day, okay? And for the regular folk, uh, like myself, I say that because it's not a matter of like your feet being vulnerable, but your feet can determine other potential issues going on with you. For example, skin. If you have moles on your feet and they're changing, okay, that may end up being potential skin cancer or melanomas. And you actually do see uh, certain types of skin cancer in the feet. Also, too, looking at your nails. Do you see dark streaks? Yes, you see dark streaks commonly in African Americans because it's related to melanin. However, it could also potentially mean some sort of other diseases to keep in mind. Also, to the shape of the nail. Is it what's called clubbing or curling? Are the nails changing color? So even with the most common, again, regular folks, we need to look at our feet too, because things can be happening which could, if not treated, uh, in your life.
Mm, Dr. Rosario, we need to take a really quick break. And when we come back, we've got more comments. but we're going to get to talking about nerve damage, or diabetic neuropathy. And again, I really want us to come back to the piece about proper fitting shoes and the roles that it plays. But I see your comments, guys, and I promise you we're going to get Dr. Rozario to answer as many of your questions as we can. So hang tight. We're going to give her a chance to take a deep breath and a drink of water. And we will be right back, guys. Don't go anywhere. And I love your questions. Thank you so much.
Get it, slip it, cuff it, check. Talk to doctor now and share it. Get it, slip it, cuff it, check. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
All right. I want to thank you guys so much for hanging in here. We've been having just a really in-depth discussion with Dr. Alicia Rozario, and I love it. I see your comments, and I have to, just briefly share, Dr. Rozario, we've got really great information. Thank you. This is great information that I realized for foot care. Just hearing that and knowing that others have shared that they've lost family members to amputations and those kinds of things. So people are just saying thank you so much for this information. You're so welcome, Miss Quinn. Thank you so very much. Okay, now we have a question, and I'm going to put it up because I want to make sure that I'm getting it right. The viewer is saying that I have to size up a half size in some shoes because I have a high instep. Will that cause issues as I age?
No, that's an excellent question. So no, it shouldn't. And actually, one thing is most people end up wearing shoes that are much smaller than they're supposed to. So me, for example, I even now I'm guilty of it. I wear a size 8.5, but when I saw my podiatrist, I was told that I should be wearing a size 9.5 shoe. And I was like, wait, I'll be like swimming in those shoes. What are you talking about? Looking like boat feet. But it actually made sense when the podiatrist broke it down to me and showed me how my gait is in terms of wearing the shoes, the proper fitting shoes compared to the shoes that I normally wear. So the lady, she's probably on track as far as having a shoe size that's half a size up anyways. One thing too, as you age, your feet age with you. And with that, going back to your feet, you have 26 bones in your feet. And with that, you have lots of tendons and ligaments going on. And things just start getting more lax in general. Okay. And with that, your feet start to change, and your shoe size, if you're doing it right, is going to start naturally increasing anyways. So in terms of what she asked, most likely she's right on track. And if anything, she may end up wearing that shoe size and may even having to increase it over time.
Oh, okay. Thank you so much for that. That's interesting. Did not know that. But before we went to break, Dr. Rozario, one of the things that I'd ask if we could get into talking about, what diabetic neuropathy is and why that's really important. And as a podiatrist, the role that proper fitting shoes play into that. So can we talk about, first of all, let's talk about what diabetic neuropathy is, because some people aren't for sure. Oh, I hadn't felt, from my knee down to my foot, in 30 years. And the role that actually plays, and for you as a podiatrist treating a patient who has diabetic neuropathy.
Absolutely, absolutely. So going back to what I said earlier, people with diabetes, they're more vulnerable. They're what's called immunocompromised. And with that, in terms of in terms of their sugar control, their management, different parts of their body and systems are get compromised. One of the number one issues has to do with nerve pain, neuropathy. So people with diabetes, and when they reach this neuropathy term, they may exhibit different type of symptoms. The most common one is numbness. There are people who they can feel, but they still have neuropathy, and that's because they exhibit burning and tingling in their feet, and they most notice it at night. And why is that? Because they're not as active when they're sleeping. Now, podiatrists, what we can do is see, as far as the trans transgression, the processes in the neuropathy. So what we do is we use different instrumentations, and we see where in the foot they're able to feel, pardon me, and at what level. Like you mentioned earlier, some people, they're not able to feel up to their knees. Some people, they can feel, but say maybe up to just the midfoot of their foot. Some people just, they can't feel once you get to the ankles. Some people, they can only feel at some people, they can't feel the toes, but they could feel in the bottoms of the feet. So all of that depends. Okay, so for podiatrists, we're able to monitor that. We're able to have these important conversations about foot education. Okay, checking your feet daily, putting your hands and putting your hands in your shoes and making sure everything is okay. Now, and with neuropathy, there are different medications that you can do to keep it, that you can take, pardon me, to keep it managed. And the most common one, which people may know about who have diabetes, or a loved one, they're a caregiver of a person with diabetes, is called gabapentin. That's the most common one. And for people with diabetic neuropathy, they may start out taking it just at night. If it starts progressing, their dosage may get increased, or they may have to take it throughout the day. But yes, and neuropathy is very, very serious in the community, with diabetics. And so with that, you need good shoes, and you need shoes for diabetics that are accommodative. Okay, that they're wider toe boxes. They need to have actually different type of arch supports.
Mhm.
Okay, they're more accommodative insoles because of all of these different issues with the feet.
Yeah. Oh, wow. Okay. Look, even if they're ugly shoes, because that's all I think about,
Like Frankenstein, I'm like, you better wear those shoes. Come on.
And you said earlier for women who are wearing, okay, apple bottom shoes. Look, I'm like, a man created those shoes and they are not comfortable. And just because right now at 18 to 25, 35, yeah, they look good. But guess what? When you can't walk, when you hit 36 and 40 and
Mhm.
50, it's a whole nother ball game. So,
Exactly, exactly. It's not worth it. If you're young watching this, trust me, it's not worth it. You're going to be saying, "Oh, my bunion, my foot hurts," by the time you reach your 40s and 50s, and then that's just going to be a lifelong issue.
right.
Okay,
Right.
so
Right. So look, I'm saying shout out to you because definitely, and I say to people, where you going? Look, I'm being comfortable. It's about comfort for me, and at my age, it's like I don't care what you say. I can be dressed to the nine from the top of the head to the bottom of my ankles.
Mhm.
I want uncomfortable shoes. So we have a question. Let me put it up here for the viewer, and from one of our viewers, and they want to know: Can tight hamstrings affect your feet?
Yes, absolutely. What I mentioned earlier, with people, for example, who have plantar fasciitis or heel pain, stretching is important. That really helps it. I'm reading a book now called The Power of Stretching. Stretching could do so, Stretching does so much for your body. Like I have back issues, stretching helps. I have foot issues, stretching helps. So yes, working those muscles, stretching out those muscles, it all connects with those tendons. Everything kind of connects as you go down to your feet. So yes, that's absolutely important and necessary.
Okay, good. Somebody said, "Oh no, no apple bottom shoes for the ladies," right? Um, Now, a viewer just made a comment about they bought some Crocs, ugly, but they feel good. But
Mhm.
I have heard that Crocs actually are not the best for you. What say you in that regards? Because I know that I own several pair, and I started to notice that I was having kind of like a hip and back issue. And when I stopped wearing those and went back to, you know, sneakers that, you know, that have insole inserts in them, then, I don't have that problem. So can you just speak to that real quickly?
Yes, absolutely. So I will say, back when I was in podiatry school and residency, I was guilty of wearing Crocs because Crocs was like the in thing. And I was like, oh, um, medical professionals, they wear Crocs. And that was like one of the biggest mistakes that I could have made for my feet. So Crocs are those kind of, or Crocs adjacents, they're terrible. Most people end up developing issues when they wear Crocs, or eventually around their ankles and arches, because they don't have the quintessential aspects. The main thing in terms of a good supportive shoe is what we call a good heel counter. So on the back of your shoe, okay, you have that heel, and you want that heel to be sturdy and hard, not be able to be collapsible or flat or anything like that. Think of that as like the heel is like the spine of the shoe, okay, like the spine of your body. That needs to be hard and firm, because that controls everything else. When you're wearing Crocs, your heel, you're not having the support. It's like all over the place. You end up putting more stress around your ankle, more stress along the arch, more stress on your toes. They're having to grip more. Okay, so all of that is bad, and that's what people end up uh, finding out of eventually. Is wearing those shoes are counterproductive,
So
counterintuitive.
I'm sorry. So even if they're putting insoles in the Crocs?
That it's still not doing you justice, because you don't have that heel, again, that supportive backing. You need that supportive backing,
Mhm.
for your shoes to give you
Okay.
the full support you need.
Okay. All right. So we have another question from Mr. Briggs. How about heavy steel-toe boots? Are they problematic for your feet?
Yes, so yes and no. So I have persons who I see who are like construction workers, or they operate forklifts in warehouses and so forth, and they're like, this is required. So, and with steel-toed boots, it's not necessarily an issue if you have the support inside, and if you still have those other basics that were mentioned earlier. For supportive shoes, you need a good arch. You need the good arch support. You need that strong heel counter that I mentioned in the back. And for persons with wearing steel-toe boots, they need to make sure that they're wearing the kind of boots to where the steel toe part actually has like a wide enough box, wide enough space. Okay, so your feet are able to, at least inside your toes, able to have enough space to move around, because you're not going to have that give. Also, too, people wearing steel-toed boots, you got to have those insoles in there, those inserts, because that will also make a difference, since you have to wear those particular types of shoes.
Okay. All right, thank you. Now we have one viewer. And guys, I'm loving the question. So Dr. Rosario, eventually we'll get around to whatever else, but I think this is important that we get these answered. Um, Mr. Steve says earlier you touched on bunions and that he's had bunions his whole life. As he aged, should he consider surgery? They've never bothered him, but he's just concerned it might be a problem later in life.
That's an excellent question. I'll have people come in and they'll say, "Oh, I have bunions," or "Oh, I have just other things going on with their feet. Oh, I have like these claw toes and so forth." Good rule of thumb: if there isn't any pain, don't do surgery. Surgery is permanent. With surgery, I'm not against surgery. I've performed several bunion procedures. The thing with surgery, there's no comeback from that. So in general, for a good rule of thumb, if there's no pain, leave it alone. People with bunions, it's important to still support that, because what can happen is it may end up getting worse later on, especially as you age, as mentioned. So this is the whole prevention piece coming on, because you don't have the pain, Mr. Avila. What I would suggest is that you wear the good supportive shoes and the good supportive insoles, which may want to get the kind where there isn't much of that pressure with your big toes as it's coming down. You want to maybe get some kind of insoles where it's offloading it a little bit, okay, so that you won't have as many issues down the line. So as far as right now, don't get cut.
You said it's permanent. So, Dr. Rosario, let's just kind of, our time, I don't know where it goes to, it gets away, but I wanted you to touch on, what may cause cold feet. People get cold feet. What could be some of the causes of people having cold feet? Or you kind of touched on neuropathy, but sometimes people just say my feet are cold, they feel numb.
Mm-hmm. Oh, absolutely. So with cold feet, it normally has to do with issues with circulation, poor circulation. You do commonly see that in diabetics. They have poor circulation. So when I analyze their feet, I'm not able to feel their pulses. So when that's the case, I may end up having to use some other devices to make sure that there is some flow going on. Now, for the common folk, the same thing can apply in terms of poor circulation. For example, I have something what's called a Raynaud's phenomenon. You see it in as early as people in their teens, but more likely people about less than age 30 and then onward. And that's where people where their hands and feet tend to be cold, and that could be and that has to do with like just the smaller arteries they constrict, and they're not able to have that supply that's more, that should be more readily available. That can be the onset, or the reason could be due to the environment, the temperature. It also be due to things like stress, anxiety, which can cause it. So those are some of the things that I could think of off the top of my head with poor circulation. And diabetics, it's just kind of commonplace. And for regular folk, one of the common indicators is people with Raynaud's. There isn't any cure for Raynaud's. Once your hands and feet, you notice that they're just cold a lot, all you could do is just do your best to if you're having a experiencing stress or anxiety, to manage that in terms of your hands and feet just being cold at the time, to warm them up.
Okay. All right. So let's talk about home remedies as it relates to foot care. People who have foot odor or, athlete's foot. Um, I've read that vinegar could play a role in that. So, what would you say to someone who wants to take more of a naturopathic, way of dealing with foot odor or athlete's foot, which can actually smell pretty horrible?
Oh, absolutely. So it's interesting that we're bringing this up because I had a patient today who told me, "Oh yeah, fungal toenails runs in my family, and we treat it with Comet." I was like, "Comet?" So I've heard all sorts of things from vinegar, peroxide, today Comet. uh, with that, you will be surprised as far as like if the treatments are effective. It has varied. I know I sometimes tell people Vicks Vapor Rub for thick toenails. It actually does treat. It actually does work. The one thing I will say though is err on the side of caution with all of those things, especially when you're dealing with caustic chemicals. I will say absolutely not. Do not do it if you have a pre-existing condition, such as diabetes.
Yeah,
I see a professional.
right. Right. Okay. So, comment. That's a new one. All right. So, Dr. Rosario, let's talk about what are some tips, just in general, if you had to just rattle off three or four, what are some tips to maintain healthy feet? And ladies, don't get upset if she says you need to sell your apple bottom shoe.
I'm not gonna do it. Even going back to the to heels, some places it just makes sense. It's kind of appropriate. I
Hmm.
know I'm a part of different organizations where that's kind of like the dress code. So with that, even if you're just aware of it, like you know what, let me wear my flats or my good supportive shoes until I get to the event, and then okay, now I'm gonna wear my heels. I'm not going to stand up that much. I'm not going to walk around that much. Okay. And when you get home, take them right off.
Right.
Okay. So I get it.
Right.
In terms of just, but in, in terms of just good, healthy feet, what I keep saying over and over again. Okay. I feel like I'm a broken record, but good supportive shoes, excellent insoles. Think about your hygiene. Okay. Changing your socks daily. For diabetics, I recommend white breathable socks. And that's because if you step on something and there's bleeding, you're able to see it. Moisturize your feet. Keep your feet hydrated, although don't put anything in between your toes, okay? Because that can lead to skin breakdown and variety of things, bacteria, fungus, and so forth. So I would say those are the quintessential things: that shoes, insoles, socks, and moisturization.
And of course, don't cut your ingrowns.
They're ingrowns, y'all. I'm telling you, you may be tempted. There are things you can do to prevent them. Uh, as get an orange stick, one of those things where you could go and kind of separate the nail from the skin. Okay, the get a nail like an emery board and just go in one direction, just one direction. Okay, if you go back and forth like a scissor, you're actually going to make things worse. Even get like a little nail floss, some floss. Okay, I'm a flosser. That actually helps, dental floss, to separate it. But once you have it, you need to see a professional. Absolutely.
Oh, okay. All right. So, Dr. Rosario, I'm listening to you. First of all, again, I want to thank you, but your energy is off the chart. I love that. And just when you hear someone that talks about their profession with as much love and excitement. That goes a long way. One viewer did ask a question about consultation, and if someone came to see you, what did that involve? So I'm going to ask you that, and then what is it that you want people to take away from this show? So you guys have been flashing Dr. Rosario's office number. Call her, make an appointment, don't wait, never put off until tomorrow that you can do today. And I'm certain if you called right now, she probably has an answering service and she will get back to you. But Dr. Rosario, I want to, in the essence of time, I would like to yield to you and ask, what can people expect if they have a consultation? By the way, do they need to bring a pair of shoes that they wear with them? And, what do you want people watching this show to take away?
Absolutely. I will say, in terms of a consultation, bring your most commonly used shoes. For that, it gives me a sense of how you walk, because I actually look at the bottoms of your bottoms of the shoes, and that's how I'm able to determine that. So, in terms of consultation, I just find out your whole. I want to know your whole general background, previous surgeries, medications you're on, what type of activity level you're in, if you what kind of work are you in, and from there, we could take it from there. As far as I have you walk around, what's called a gait analysis, and then we'll able to come out, and then we'll be able to come up with a plan. One thing I want to leave. Oh, and I also will say that I am taking new patients, so please go ahead and give me a call. And one thing I want to have everyone take away from this is that feet are your friends. I know you literally look down on your feet, and people sometimes ask me, why are you a podiatrist? Because they're just shocked that I work on your feet. But feet are very, very important. You need your feet to get around, okay, in terms of your mobility. And trust me, if you take care of your friends, they will take care of you. This could be a long lifetime friendship that will have lasting benefits versus being a person later in life where you're not able to get around because you have poor feet.
Yeah. Okay. Last quick question from one of the viewers. And you guys, I love all of this. Thank you so much. But unfortunately, we got to go. But is there a good length for toenails? That was the question. What's a good length for toenails?
Let's just say for a good length of toenails, you don't you don't want it too long where you're not going to be able to wear shoes that you need to, or where there's an issue in terms of it potentially catching on your socks. So with feet in general, you want them short. However, not too short where you put yourself at risk of getting ingrown toenails. So again, a good rule of thumb is to have just where you just barely see the white, and where if you are going to have your nails cut, that they're cut across. Okay, they're cut across. Now, if you see a podiatrist and so forth, they may trim it around based on the shape of your toe, but have that be a good rule of thumb. You want actually short as possible and to cut across to prevent that ingrown.
Okay. All right. Well, Dr. Rosario, first of all, I want to thank you so much for being on the show. We'll have to have you come back because clearly there are a lot of people who are trying to get on the good foot, and I'm grateful for that. I hope that you will agree to come back at a
Absolutely.
at a later date and time. And again, I have been flashing Dr. Rosario's information up on the screen. Dr. Rosario, don't you go anywhere. I'm going to be right back with you. Okay? So
Thank
don't.
you all. Thank you so much for having me, and thank you all for participating and asking me these questions. Okay, it's really kept me on my toes and giving me the opportunity to let you know just how much feet are important.
Yes, yes. So don't go anywhere. I'll be right back with you. I want to say to all of you who have tuned in, I want to thank you so much, you guys, for being here on the Gloria Bailey Ray Show. We're changing some things, but as I said, it's still going to be great content, great guests, great information. And I'm going to ask each of you to do something for me. I'm going to ask that you guys like and follow me on all my social media pages. Please, please, please do that. And it's very easy. Everything is Gloria Bailey Ray. But again, um, I guarantee you, you won't be disappointed. Just set your dial for every Tuesday at 5 p.m. It's really 55 minutes. Today we ran over a little bit, but it was all for the good of getting your questions answered. Um, Remind you that if you should miss an episode, you can always go back and check it out on YouTube. And be sure and click on the live on YouTube where it says live. That's where the shows are housed. And I just want you guys to know how much I appreciate all of you. Thank you all for your support, for tuning in. And it's always a blast. I love doing this and I love what I do. And as I always say, if you didn't take anything away from today's show, then it's really you who didn't get the memo. But until this time next week, I want you to have a wonderful, blessed week. Give thanks for all of your blessings. Stay safe and remember to pay it forward. I'm Gloria Bailey Ray, and I appreciate all of you guys. Thank you so much for being here. Until this time next week, be well, peace, and blessings.